I'm very fortunate today to introduce Mariah Mahotz, who is a practice nurse at our neuroendocrine tumor clinic at Cedars-Sinai. And we're going to talk a little bit about carcinoid syndrome. We know it's associated with diarrhea, with flushing. Sometimes it can even cause cardiac problems. And we're very fortunate to have an experienced nurse with us today to talk about this. So Mariah, how do you feel about patients whose carcinoid tumor or the carcinoid syndrome is not well controlled?
It's very hard in the day-to-day for patients whose symptoms from carcinoid tumors are uncontrolled, whether it's the flushing and diarrhea that they experience. They can have these flushing episodes that can make them short of breath, feel lightheaded, they have to lay down, leave them very fatigued afterwards. And unfortunately, there's nothing really that signals when they come on for them. So having to monitor very closely during the day through these. And same with the diarrhea episodes. These patients don't know when they're coming on. They can have, up to 10, even more episodes of diarrhea a day that then have to be monitored, and is very limiting in a day-to-day activity for them.
Absolutely. The symptoms can be quite difficult and negatively impact quality of life, unfortunately. And what would you recommend to our patients about what they can do to prevent these types of symptoms from happening?
So especially for the diarrhea, one of the big things that people talk about are the 5 E's that you need to watch. So ethanol, cutting alcohol, because that can be a big trigger. Eating, so making sure that you're having smaller meals, no large meals. Cutting foods that have amines in them. No spicy foods, no caffeine, making sure any raw vegetables are cooked really well, foods that are hard to digest. Exercise can be a trigger, emotional stress can be a trigger, so trying to limit stress, and epinephrine, so if you are going under any procedures to make sure that you know as well to have that monitored because you may need medications. So those are big ways, and then making sure with the diarrhea that if you're taking any medications like Imodium or Lamodal that can help with the diarrhea to stop those. Also, Zermello is a medication that some of our neuroendocrine patients are on to help with the diarrhea as well. Making sure, especially with pancreatic neuroendocrine tumors, if they are on any enzyme replacement, making sure that they're utilizing and optimizing the doses of those, taking them correctly, that can all help with the diarrhea as well.
Yeah, these are great suggestions. And is there anything that you recommend, practical advice on how patients can reduce their symptom burden?
Yes, definitely, especially with the eating, watching what you're eating. We recommend patients to keep logs of what they're eating, day-to-day activities, different things that they can kind of monitor to see if there's anything that triggers episodes more than other things, so we know to cut those or to try to help recommend how they can limit those things in their life.
Yeah, that's really good advice. So Mariah, what kind of advice would you have for other practice nurses about how to control carcinoid diarrhea and how to improve their patients' symptoms?
Definitely one of the biggest things is making sure you're keeping open line of communication for your patients, making sure that they know that they can go to you when they're experiencing anything, and that you are kind of also keeping a log on different things that they can be, setting off, and definitely asking the patients, what medications are you taking for this? How are you taking them? Because a lot of times you find that patients might be taking the medications that are helping, but they're not exactly taking them correctly or as frequently as they should to help with these symptoms. So keeping lines of communication open. If you can get dietary and nutritional support in with a registered nutritionist, that is a huge help not only for you as the nurse but also for the patients, to help, especially because there's so many different foods that can trigger symptoms that they may not even know are doing it.
Absolutely, and I think it's always important to remember that even when patients present us with diarrhea and we start them on somatostatin analogs, occasionally they can experience pancreatic exocrine insufficiency, which is another cause of diarrhea. So it's very important that they receive pancreatic enzyme replacement when it's needed.